Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 you guys. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review books, courses, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to help you as well if needed. We have a 99% pass rate on all of our comprehensive reviews and a 100% pass rate on our one on one sessions. Now, I always give the disclaimer, y'all know, and if you follow, you already know my spiel. But I like to just remind you, we know there's no absolute in medicine, right? We treat on a patient by patient basis, and any other questions that I provide are designed are based on the guidelines that are currently being tested on boards on the ANCC as well as AAMP. Now, my videos, if I'm talking about what we currently do in practice, I will always say that so there's no confusion, okay? So, with that being said, let's get into question number one for today. All right, so question number one states a patient presents to the office today with a log of his blood sugar levels. He has been tracking his blood sugar every morning and evening for 3 weeks. His morning blood sugars are ranging from 260 to 320, and evening blood sugar levels are ranging from 50 to 64. He currently takes metformin in the mornings, but is concerned about there's a concern that his blood sugars remain so high at that time. What is the best recommendation at this time? Is it A, stop metformin, B, instruct the patient to eat a diabetic appropriate bedtime snack, C, start Lantus, or D, nothing at this time, instruct the patient to continue to keep a log to see if this continues? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is even being asked of you. I know it just seems like, Brittany, what are you talking about? But just trust me. And sometimes we know this is what we should do, but we don't do it because we just want to go through things and get it done. Trust me, when you are on your exams, when you are taking boards, just do the extra steps because even when things seem a bit difficult or um you're feeling behind on any of these things or you're feeling confused or whatever, all the emotions that we go through when we're doing test questions and all this stuff is running, we're watching the clock, all of the things. But if you slow down and look at that, it'll help you to make sure you're answering what they're asking and then slow down and work through the lengthy scenario to apply what you need to apply to that question, okay? All right. So here the stem of the question states, what is the best recommendation at this time? All right. So what are we even talking about to give a recommendation, right? So this patient has been tracking his blood sugar levels for 3 weeks. They're ranging from 260 to 320 in the morning, 50 to 64 in the evening. So, high in the morning, lower in the evenings, right? He takes metformin in the morning, and he's concerned about his blood sugar. So, what do we want to do? So, in this scenario, clearly we're thinking Samoji, Dawn, all of this with blood sugar levels. He's already checking it in the morning and the evening, so we don't have to recommend that. Would you A, stop the metformin? Well, we don't want to stop the metformin right now because it's nothing showing us that the metformin is causing, any decrease in the evening, right? And if he's that elevated in the morning, he needs some type of coverage. So no, we don't want to stop the metformin right now. B, instruct the patient to eat a diabetic appropriate bedtime snack. Yes, you do want to do that because remember with the Samoji effect, what is occurring is they have hypoglycemia in the evening or at bedtime, and that as the body tries to compensate, the rebound effect calls the early morning hyperglycemia. So we need to treat the nighttime hypoglycemia. Okay. So let's have him to make sure he's having a diabetic appropriate bedtime snack, educate them on what is a diabetic appropriate bedtime snack, and then have them to continue the log and come back and see if there has been any resolution from there. Okay. You don't want to start Lantus because that is a long acting insulin, right? Providing coverage for all 24 hours. So we don't need anything additional to lower the blood sugar in the evening. And then, of course, we're not going to just say nothing at this time, right? All right, so question number two. The nurse practitioner and NP student are evaluating a patient today with notable bruising around the umbilicus. The nurse practitioner diagnosed the patient with pancreatitis after review of his labs and full assessment. The NP student is inquiring what the bruising around the umbilicus is called. What is the best response by the nurse practitioner? Is it A, Murphy sign, B, Cullen sign, C, halo sign, or D, psoas sign? Take a moment and tell me what you got in the comments. All right, so stem of the question states, what is the best response by the nurse practitioner? All right, so what are we responding to, right? So nurse practitioner, NP student are discussing a patient that they have. The patient had notable bruising around the umbilicus. After further review of lab work and full assessment, the nurse practitioner has diagnosed them with pancreatitis. But the NP student is, they're learning, so they're trying to figure out what is it called with that bruising that was noticeable around the umbilicus. So here is a knowledge-based question, but you should know it and pay attention to the clues, right? Is it A, Murphy sign? No, we know Murphy sign is actually more so of a maneuver assessing for cholecystitis, right? B, Cullen sign? Yes, Cullen sign is the bruising around the umbilicus, commonly shaped like a C, and it is a exam and finding to help aid in the confirmation of a diagnosis of pancreatitis. So it's telling you this. It's telling you the nurse practitioner came with a diagnosis of pancreatitis. B, Cullen sign is your answer. Okay. All right. And lastly, let's go to question number three for today. Question number three states the nurse practitioner and NP student are discussing cranial nerves. They are currently discussing the cranial nerve associated with the face, cornea, and jaw. Which cranial nerve are they discussing? Is it A, cranial nerve 1, B, cranial nerve 7, C, cranial nerve 5, or D, cranial nerve 8? Take a moment and tell me what you got. All right, so stem of the question states which cranial nerve are they discussing? All right, so let's see what the discussion was. So it's the nurse practitioner, NP student discussing cranial nerves. They're talking about one that is associated with the face, cornea, and jaw. Is that cranial nerve 1? No. Cranial nerve 1 is what? One node, right? Olfactory, right? Cranial nerve 7? No. Now, although cranial nerve 7 does have to do with facial, it's not just, it doesn't have anything to do with cornea and jaw, right? So cranial nerve 5, answer C is your best choice. Think about um trigeminal neuralgia, right? Because that's that trigeminal they call it trigeminal cranial nerve 5, right? Trigeminal neuralgia is assessing, I shouldn't say assessing, is associated with all of those locations where they can have that pain running from the side of their face to the jawline and sometimes with the eye pain or cornea, right? So think about all those things, and then if not, you can eliminate these, right? The two you probably would have narrowed it down to are B and C. D is cranial nerve 8, which is acoustic. That has to do with hearing. We're not even talking about anything like that. So A and D we could have eliminated. And then to walk it through, you should have said, cranial nerve 7 is facial. So even though we're talking about the face, does it include the cornea and jaw? So C would have been your best answer. Cranial nerve 5, trigeminal. Think of trigeminal neuralgia to associate all of those things. Okay. So I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And make sure you meet me back here, okay, you guys? And if you need any of our resources or tools to assist you in any of your exams with school or boards, just give the Nursing Studio a call at 803 400 6864. You can also shoot a text message to this number or email us at the nursing studio, the number one at gmail.com. We offer a review book. I have a review book that is an ebook option as well as a paperback option. Both are linked in the bio of this channel. Our ebook, of course, you have once purchased, you have access on any device immediately. And for the paperback, it is shipped to you. So if you have like Amazon Prime, as soon as you can get it is in 2 days, right? And this book is broken down by system. It is in color. There are images. You know, I'm big on visuals, so I like you to look at that, especially the derm section has visuals, the images, because you know my breakdown. Hey, know the condition, know how it presents, see an image so you can visualize it. So that's how I have it broken down in a chart format for the derm section in the book. Again, it's system by system and it's short and sweet. It's one of these resources that is on the go, just kind of review fast with it, because I break it down in a assessment, diagnosis, evaluation, and treatment as I always teach. And then we have a interactive section in there as well that is broken down in that same fashion where you just fill in the blank on that. And then there's practice questions in the back, with rationales. Again, those are linked in the bio of this channel if you would like any of those resources. We also offer a self-paced review course that you can watch on the go on any device. It's broken down by systems. It's me teaching you through each one of the systems, hitting those high points, giving you Brittany's brilliance mnemonics and trying to help you tie it together, and hitting the things that you really need to know and pointing it out in the assessment, diagnosis, evaluation, and treatment format. Again, it's broken down by systems. It's for FNP and adult Gero review students preparing for ANCC as well as AAMP. I have added that link in the bio of this channel as well to make it easier for y'all to access. Um, there's many quizzes associated with each of those systems as well. So just to kind of test your knowledge, but you are able to listen to it as many times as you would like. And it's just a monthly subscription and you just stop it whenever you want to. And then our 5-week review course, our next one is June 10th uh, through July 19th. This is broken down Monday through Friday. You have assignments. We do weekly practice questions. And then the final week is an individualized week so that you are able to work with me. We gauge your exam readiness, and then I provide feedback for how to proceed. And if you want a one-on-one session, I always recommend reaching out via telephone or email so that we can gauge what you really need and see how we can assist you, because the one-on-one sessions are customized based off of your weaknesses and your study timeline. So we have to have a discussion to see what works best for you. But if you need any of those, as I said, just give us a call at 803-400-6864 or shoot us an email at thenursingstudio1@gmail.com. I hope y'all are having an amazing day. And as always, make sure y'all meet me back here. Happy studying. Bye, y'all.